Shalom and welcome to NeshamaCast, exploring Jewish spiritual care today, brought to you by Neshama, Association of Jewish Chaplains. I'm your host, Rabbi Ed Bernstein. Professional Jewish chaplains are trained in evidence-based practices of spiritual care, and we also draw from the wisdom of Jewish tradition. Today we're going to focus on the evidence-based part of the equation. Today's guest on NeshamaCast, Chaplain Allison Kestenbaum, has been at the vanguard of research in the field of spiritual care. I'm excited to talk to her about the purpose and practical uses of research in the field of spiritual care and how it ultimately benefits the people whom chaplains serve. Allison Kestenbaum is supervisor of spiritual care and clinical pastoral education at UC San Diego Health. She is a board-certified chaplain with advanced certification in hospice and palliative care. She is also a certified pastoral educator through ACPE. She has received prestigious awards for her research in advancing the field of chaplaincy, and we're honored to have her with us. Allison Kestenbaum, welcome to NeshamaCast.
Thank you for having me.
I'd be remiss if I didn't also mention that you were my instructor for an online half unit of CPE in the early months of 2020 as the world was shutting down for the COVID-19 pandemic, and it was largely through your encouragement and guidance that I went on from there to pursue board certification. So I am personally grateful for your mentorship.
Well, it was such a joy to have you in our program, and to be able to do CPE together across many, many miles is one of the magic aspects of technology, one of the good aspects of technology. So, and our program here is, we were celebrating quite a lot when we learned that you got board certification.
Thank you. Thank you. So, Allison, to set the stage for a discussion on your work as a spiritual care researcher, I'm wondering if we could start with a bit of your spiritual and religious origin story. What was your spiritual life like growing up, and what was the path that led you to becoming a chaplain?
Always special to have the opportunity to look back to see how these things shape us. My early spiritual life growing up in I guess I would say traditional Jewish home in New York City. We were not big synagogue goers, but we practiced, a lot of the traditions and holidays and rituals at home with family, which made a big impression on me. And I had kind of an interesting mix of Jewish upbringing in the sense that I attended a Hebrew school in Astoria, Queens in the 80s, which was a time where there weren't a lot of other Jewish kids around. And so it was a very diverse group of kids, a small group with a wonderful teacher. And then soon after that, I started attending a workman circle Yiddish shula. It's interesting to call that a spiritual or theological education because there wasn't a whole lot of talk about the theological aspect of our tradition, but just so much that I learned about Jewish culture and Yiddishkeit and the Yiddish language and social justice. So I would not trade that upbringing for anything. It really gave me quite a glimpse into part of the diversity of the Jewish community. And I'll also say that whenever I have a patient in front of me who says, "Oh, I don't need a chaplain, I'm an atheist," I'll say, "Oh, well, actually, I think atheists have some of the most rich spiritual lives that I've encountered based on that early experience." So that was some of my early upbringing.
In listening to this and reflecting on our earlier guests on the NeshamaCast, it occurred to me that our previous guests, all of them first received rabbinic ordination, then became professional chaplains. But I don't believe you have rabbinic or cantorial ordination, yet you became a professional chaplain. Some listeners might be surprised that one does not need ordination to become a chaplain. How common is it for chaplains not to have ordination? And what compelled you to pursue chaplaincy in general and without going the ordination route?
I really appreciate that question because especially as a CPE educator, I encounter individuals who are just standing at the beginning of the path of professional chaplaincy and trying to understand what kind of education or ordination or what have you will be needed. So my personal situation was that And I really actually have Neshama to thank for this. I was working at UJ Federation of New York in the Caring Commission after grad school. And that's where I learned all about Jewish chaplaincy as a profession and just the ways that it was supporting health and human service and healthcare in that area and also in Israel and of course all over the country. But that was where we were focused. And, I was meeting all these Jewish chaplains and I had been thinking about going to rabbinical school after grad school, but there were various reasons why that didn't happen at that time. And I just met all these chaplains and they helped me to understand that I had a master's in Jewish studies and that there was a pathway that actually the Jewish community, and particularly Neshama, had recognized that Bikur Cholim and professional
Visiting
Bikur
the
Cholim
sick
is just a huge contribution to our community. And the ways in which Neshama sort of broke down the barriers for that. Certainly they encouraged professional training and I had to have all kinds of credentialing and was subject to the same certification process as any other board certified chaplain. But there was this understanding that of the lay chaplain and that could be a role of leadership in the community and that it could overlap with, rabbinic or cantorial background, but it could also stand on its own. And I think that's one of the things that I've seen Neshama do really well. I'm not sure how common it is at this point. I know there are some others, particularly in the Orthodox community where ordination for a time and depending on where you are is not, or was not possible. And so, but yet there was a very clear role for women to provide professional pastoral care. So that kind of led the way too. And now one thing I'll share just for anyone who might be interested, there's all these great programs coming out in chaplaincy studies where you can do your master's in chaplaincy studies through a Jewish lens, like the Graduate Theological Union out in Berkeley has one. JTS has some programs like that, Jewish Theological Seminary, and there are others. And that just didn't exist 25 years ago when I was coming up. If it had, I would have done that. But so that's all to say that there are ways now of pursuing professional chaplaincy, having a good, solid Jewish education and being, sort of recognized by the Jewish community to do the work, but to not do so as a ordained rabbi or cantor.
How did you find your way from becoming not just a chaplain, someone doing the work in the trenches of bringing hope and guidance to people, but becoming a teacher, a chaplain's chaplain? What was your path like to becoming a chaplain educator?
I started my CPE training. I think whenever chaplains listen to each other, they always want to know the lineage. Who did you learn with? Who were your teachers? And when I started, there was a CPE program, and I think it was there was a Jewish pastoral care program at what was then the healthcare chaplaincy in New York. And I did a unit at Mount Sinai with Rabbi Naomi Kalish. And that just really kind of opened things up for me, really opened up that path. And so once I started doing CPE, I was hooked. And so I decided to do a residency. I went out to San Francisco, University of California, San Francisco, and was just blessed to work with really wonderful interfaith CPE educators. None were Jewish in that region, but I felt just very well mentored there. And I was looking around, it's just so interesting what modeling does in helping us just shape our own future, because when I was at UJ, I was so inspired by all the chaplains I was meeting. And then when I started doing my CPE training as a student, I was really inspired by the educators. Many of the educators I knew there were also administrators in spiritual care departments in healthcare. And I've always felt very drawn to healthcare. I kind of feel like hospitals are as sacred, maybe sometimes even more than traditional houses of worship, depending, at least in my experience. Because like I said, I didn't really grow up going to synagogues very much, but as a kid was actually spent some time in hospitals as a patient. So I just really felt like hospitals and healthcare was a place that I just found a lot of meaning professionally and hoped that I could make an impact. So I started supervisory training after my CPE. And that was a long process, as I guess it should be. A lot of formation, a lot of mentoring, hard skills that I learned as a CPE educator, and just a lot of personal growth. That's very much a part of me. And having that being integrated with my own spiritual and theological, really learning, having that an opportunity to articulate all that. So I became an educator, and, I was also really excited to work in academic health centers. That's mostly where I've worked in my career so far. There's a culture of teaching faculty. So almost everyone that you encounter, every physician and a lot of the nurse leaders, and other disciplines as well, pharmacists, you're encountering people who are doing their clinical work, but they also have some kind of teaching role that they're doing. And it's just seen as so intertwined. That whole expression of learn one, do one, teach one. I just think that, that really helped to solidify my practice as a chaplain. my gosh, there's just so many students that I've had the opportunity to work with, maybe for a unit or multiple units, who have gone on to just do such incredible spiritual care, either in their own denomination or in healthcare or Hillels, just all over the country, all over the world. So it's just really very generative to be involved in education.
It's very gratifying to be able to teach someone who then goes on to teach other people. There are so many aspects of your career that we could focus on, including your role as a chaplain educator, but I want to turn our focus now to your work as a researcher. So let's start with a basic question. What is spiritual care research?
So I would say spiritual care research it's a big umbrella, and it's a focus in research that has just really grown tremendously, especially in the last 10, 20 years. And I would say it's an inquiry into describing what spiritual care looks like in various settings. I mean, personally, most of the spiritual care research I've done has been in healthcare, though I have done some in community settings as well. But it's also, so it's like, what does it look like when spiritual care providers are providing spiritual care? It's sort of this idea of demystifying what's happening in that sacred space. We know something is being transformed anecdotally, but how can we describe it, and how can we start to actually test or quantify or qualify what's happening?
I suspect the end goal is not only just to test and quantify, but actually to help chaplains improve their practice.
Absolutely. Yeah, I'm glad you mentioned that, because, there's this idea of translational research, right? We have, at least at our medical center, and maybe I'm sure at others, there's, we have a center for translational research. And what does that mean? Well, the idea is that it's one thing to be in a lab, or even to be collecting data about the spiritual needs of patients, or how we're educating chaplains, or all that. But what really makes it important and meaningful is the fact that the benefits accrue to the people who need it most, the people who are receiving care. And so that's exactly it, that every kind of spiritual care research we do, there are humans that are hopefully, benefiting from us having a better idea of what is actually happening and how it can inform our professional practice as chaplains.
So take us into a bit of the nuts and bolts of research. It's not just reporting stories. I mean, you're actually using the scientific method.
Mm-hmm.
So what is that like? How do you apply a scientific method to spiritual care research?
There's so many ways to answer this. And in some ways, I'm kind of self-taught. We have colleagues now who are, completing PhDs in research to specifically do spiritual care research. And I'm so excited about that. It's already elevating things for all of us. But I'll give you my sort of 2 cents, is that I think about one way to start is to think about quantitative and qualitative research. So what that basically means is quantitative is pretty much numbers, and qualitative is the story of what's happening. And so to find which of those methods, and sometimes we can use both, they call that mixed methods when we do research. Qualitative, for example, is something like, I can give you an example of a study that I did that was qualitative in the Jewish community, where when I was working at Jewish Theological Seminary in the Center for Pastoral Education, there was a collaboration with UJ Federation again there, and they were placing CPE students in settings that had been affected by Superstorm Sandy. And the students were writing what's called verbatim. So anyone who's a board certified chaplain knows well what a verbatim is. But if you don't know, it's basically a written case study where you record what happened in an encounter with someone who you're providing care to, kind of a dialogue, and then you do a bunch of analysis to try and help develop your skills as a chaplain. And so we did that study there. That was a qualitative study where we looked at verbatims and we said, oh, that's qualitative data. Though that's written text that we can actually analyze for themes that have to do with disaster spiritual care. And then we can extrapolate some of those themes and say, here are some things that we noticed in working with this population, and topics that people who are doing disaster spiritual care might want to keep in mind. And it was in a Jewish context, so there was some of that was explicit as well. So that's an example of qualitative. And what I'm trying to imply there is that there's a lot of qualitative data for chaplains everywhere, because a case study can be qualitative research. We still are in a descriptive phase, I think, for spiritual care research, meaning that we're still trying to describe what it is that chaplains do, like I said, removing the mystery. And so having case studies from as many different corners of the kinds of care we provide really helps to fill in the picture. So that's another example of that kind of research. And then another distinction to make is empirical research and then quality improvement kind of projects. I won't go into too many of the details about that, but just recognizing that, we can set up studies that are, have very rigid guidelines to them, and there's a standardized protocol, and we're executing it the same way with every patient and trying to have that scientific rigor. And those are very much needed in our field. And there are so many opportunities for like process improvement, quality improvement, meaning with the previous research I mentioned, kind of the empirical, we have a hypothesis that we're testing through a very structured method. With process improvement, we are recognizing a gap in our practice. So to give you an example, I started working at UC San Diego Health as a palliative care chaplain, and I noticed that there was no documentation template for palliative care. So that was a gap that I noticed. And then we used evidence-based practice to develop a documentation template to kind of improve the process for the team and patients receiving care. And the reason why I mention that is to say, I think sometimes we imagine that research is only these very regimented studies, but in fact, there's so many ways of being involved. It could be process improvement. It could be being a consultant, like a content expert for others who are conducting research. And so I can talk about that forever, but there's lots of ways to be involved.
So process improvement is one way in which research can actually advance the practice of chaplaincy. I want to come back in a moment to the Superstorm Sandy project, but first, if I'm a practitioner, which I am, I work in a hospital and I want to find the most current research on best practices in hospital chaplaincy, where do I turn to? Where are the research projects published, and how do I know what will be most helpful for me?
There was a time, and maybe it's still the case, I haven't looked recently, but Neshama kept a wonderful library of research related to our field. And so that's something you might want to check out, or folks can check out chaplaincy websites. And then depending on what topic or keyword you have, really, one place to go is to pubmed.gov. That's a website, and it's basically the repository for all scientific research that's been published in peer-reviewed journals. And it's pretty incredible. You can, as I said, you can search by keyword or author or topic. And then what happens is it brings you to the journal where it's published. Now, if you are working in an academic institution, you probably have access to it. You don't even need to go to your library. Like I know at our institution, if I'm on site at the hospital, if I want to look up an article about spiritual needs for nephrology patients, and I find a journal article, if I'm here at work, it will take me right to a journal where I can access it for free. So that's one thing folks might want to know, that if you have that affiliation, you've already got that. If you don't, like let's say you're working in a community setting or a congregation, you can often reach out to the librarian or the medical librarian at the health center in your community, and they can often retrieve that information for you too. So you don't have to pay, the access fees, because those can be quite hefty.
So I want to go back to that Superstorm Sandy disaster in 2012. I encourage listeners to go back in the NeshamaCast feed to our conversation with Rabbi Shira Stern on disaster spiritual care, in which she recalls her work with Superstorm Sandy. But I'm wondering if you could describe in your own words for our listeners, what was Superstorm Sandy and what were the questions that you were asking in your research, and what did you discover along the way?
Yeah, I also fully endorse going back to the conversation with Rabbi Shira, who really is just such a role model and leader when it comes to so many aspects of spiritual care. So Superstorm Sandy was a just extremely large disaster. Part of what made it such a tragic impact was the amount of land that it hit. That was unusual. The power of it, the areas that were just previously not affected by storms in that way. I mean, it was to the point where people people lost their homes, lost their communities, in areas that were very highly populated across the Eastern Seaboard, but our focus was in New York and New York City. And so, just think about the density of some of those areas and a storm of that magnitude. When it comes to qualitative research, we don't necessarily know what we're going to find in thematic analysis. But what our process was, we read everything we could get our hands on in terms of disaster spiritual care. There's a wonderful disaster spiritual care handbook. Rabbi Stephen Roberts edited that, I believe, with others. There's many other resources on disaster spiritual care, and I wish I could mention them all. So we read all of those, and we read research that had been done in peer-reviewed journals. There wasn't a whole lot at that point, but there was some coming out. And so we came up with what's called a code book. So we looked at basically fragments, they become fragments of sentences that describe something that keeps coming up in the disaster spiritual care literature. And then what our research team did wasn't just me. We had a research team who then what's called coded all the verbatim. So let's say like a code that we saw was people reflecting on a sense of helplessness, or maybe a question of why is God doing this? So these are codes that we set up. And every time we saw that in a verbatim transcript, we would highlight that. And then we collected them all. The research team would periodically check in to make sure that we were coding similarly, kind of that, reliability piece. And then when we were done doing all that coding, we then analyzed the frequency of the codes and the content of those, like what we had highlighted in the transcripts. And we put forth certain themes that we recognized. During COVID, some of the peak times of COVID, and also in the last couple of weeks, I've been thinking about that study a lot in terms of disaster spiritual care. A couple of the themes that keep coming up to me are so many people affected by the storm wanted to talk to the chaplain about the magnitude of loss. There was sort of this need to take a census to account for it, which is like such a strong drive in our tradition and in our text, like thinking about Bamidbar and other places. So it was just really interesting that a way that people, I'm not sure, it probably would be too far to say that it's coping because I don't know that from the research, but we can say that so many people in the community affected by the storm, whether they were working in disaster relief or they lived in the communities, they felt a need to take an accounting of the magnitude because it's so hard to wrap our mind around that kind of loss. And then the other one that I really have been thinking about is this idea of what we kind of called normative loss happening concurrently with disaster loss. We talk about this in the study, and this is published, this could be read, but one example of, someone in the community who had a flood that destroyed the basement of their home and they lost all of their possessions there and all of their sentimental items. And also happened to be that a member of the family also had a heart attack in a week later or 2 weeks later. And maybe that was related to the storm, but here this person was dealing with all of the losses of the storm in their community, and then also this very personal loss as well. And so that's what I've been thinking about, especially these last 2 or 3 weeks, that there is a tremendous trauma and suffering happening, and people are also have their personal lives, just the normative things that happen. And that was something that we actually saw come out in the research. That was a theme that we found.
Allison, you also have been doing a lot of research in palliative care. Can you talk to us about some of your key projects that you've been involved with, things that you're most proud of in terms of what you've researched and discovered and how you've contributed to the field in that way?
Sure. I often say that palliative care should just be called care, because really what palliative care is, I know some people think hospice when they hear palliative, but it's a much broader umbrella. So, palliative care, just as a reminder, is interprofessional symptom management for people with serious illness. And so some of the key words there is interprofessional, meaning that there's doctors, nurses, pharmacists, social workers, chaplains, others, because we are trying to approach people as whole and to help them to have every symptom related to their illness addressed, because we know that physical pain and spiritual and existential pain can be just as strong as each other, right? And impact healing and impact someone's experience with serious illness. And then another key word there is serious illness. I worked with a dual boarded palliative care doctor and oncologist once in an outpatient clinic. And whenever we would get like a patient maybe would, bring in cupcakes or something to say thank you. And he would go around the clinic to all the oncologists and he would say, okay, I'm going to quiz you. You can have a cupcake if you can tell me when a good time is to refer to palliative care. And the people who got it right were the ones that said diagnosis, which is surprising for people to hear sometimes, because you think, oh, well, palliative care is for much later in the illness trajectory, or sometimes we get it confused with the 6 month that people are expected to live once they get into hospice. But no, palliative care can be of great help from, initial diagnosis. So that's one of the reasons why I love palliative care. It's really just supportive care throughout the process. And another reason why I've always really been drawn to it is because in palliative care, the family is considered the patient unit. And so I just am a huge fan of any approach that recognizes that we are living within complex systems. We're not just individuals. We are so interconnected in that way. So that's why I got that passion for palliative care. And in terms of research, so there have been a couple of areas over the years. And I just am very grateful to funders who have, sort of taken a chance on our research projects, entities like the John Templeton Foundation, the Cambia Health Foundation. Right now, working on a study with George Washington Institute for Spiritual Care that comes out of GW. And, without those grants, it would be very difficult to, sort of what we say, protect the time to actually do research, because there's just so much else going on in our work as chaplains. So I feel hugely grateful for that. If anyone's out there who's listening, who's able to be a patron for more chaplain research funding opportunities, it's something that we greatly need, because not only does the research get conducted, but in my case, I just received tremendous mentorship from experienced researchers. And, I can now lead modest research projects on my own based on that. But that is only because of all of those wonderful mentors that I've had in research over the last 10 or 12 years. I'm happy to also talk about specific topics, but that's some of the trajectory for that palliative care research.
Yeah, why don't you share a key topic that you've explored where you feel you've made a meaningful contribution to the field that has had practical import for practitioners?
Sure. Well, I'll point to two projects that are somewhat related. So about 10 or so years ago now at UCSF, we were able to launch a study where we looked at spiritual assessment with patients with advanced cancer. And that was a mixed method study, which again, just calling back to what I mentioned earlier, there was a quantitative aspect where we did ask patients with advanced cancer receiving palliative care about their physical symptoms and religious and spiritual coping and coping with their cancer, all different validated measures that we accumulated. And then we also had them meet with a chaplain who was trained in a spiritual assessment model called Spiritual Aim for 3 sessions, and then took pre and post interviews to see what the impact was on the patient. And then we had transcripts of that. So we had tons of qualitative data to look at, which we coded all of those encounters with the chaplain, again, to pull out themes. And what we found in that study, it's what's called a pilot study, in the sense that the number of participants was like 31. So we can't make huge generalizations from that number. We would want to have a much larger N, as they say. But there were statistically significant changes that we noticed. I was super bummed because I hoped that the data would show that chaplains helped improve symptoms like depression and anxiety and all that. And the data did not show that. But what the data did show was that there was improvements in certain aspects of religious coping, spiritual coping, that kind of thing. Almost like the instruments that were meant to measure for that actually picked up on the change, which was kind of cool. And it also gave us an opportunity to articulate the spiritual aim model. And then the next project that I'm going to mention is...
Before you go, is AIM an acronym for something? AIM?
Yeah, so it's Spiritual Assessment and Intervention Model. And we were able to... This was a model that Reverend Dr. Michelle Shields, who is one of my mentors in San Francisco, had been teaching for years, but it had never been written down. It was oral Torah, but we were able to use this research project to describe it. So that's an example, right? Where, yes, there was an empirical aspect to the project we were doing, but a big part of that project was even just writing down, describing what is this spiritual assessment model. So it's there so that other people could access it. Then with research time and funding later, I was able to, with the help of my research colleagues, to develop a manual to teach spiritual aim. So we used cases and patient quotes from that first study to develop a manual to be able to teach people how to use spiritual aim without them coming to do CPE. And one way to learn spiritual aim is to come do CPE with me, but more practically is to be able to download a manual that we have that's on spiritualaim.org, and it's completely free. All you need to do is just put in your name and email address, and then we send you a PDF. So what we did there was that helped us then develop a palliative care CPE program. So that was part of the curriculum, spiritual assessment, but also all the other aspects of CPE you might recognize. And this was, I think, one of the first times that anyone has studied what a specialized CPE program in palliative care could look like. So we did have that article come out recently. And, that was a qualitative project, but what we were trying to do was to look at approaches we had taken when we built the CPE program to help people of underrepresented religious backgrounds and people of color access palliative care clinical training and CPE. And so that research project was about, looking at the strategies that we had used, some of which are from medical education, things like financial support, meaningful mentorship, hybrid placements, so that people who can't just give up their whole work week to do CPE we were able to make adjustments. And so in the research we did, we were looking at impressions of the students about what impact that had on them, and if it had the intended impact. So I'd say that the palliative care research, at least that I've done, has been very connected. It's sort of one thing has led to the next, or there is that kind of overlap. And we have so much data. There's probably 50 more papers that could be written from the data that we have. And that's kind of what happens when we start collecting, especially qualitative.
And then, of course, every chaplain is different and can interpret the research in ways that can guide them in their unique ministries. I remember you've talked about the metaphors of GPS versus a roadmap, and that GPS kind of tells you exactly what to do, and a roadmap is like a general guide. So it kind of sounds like research can provide a roadmap to practitioners in the field to forge their own path.
Absolutely. Yeah. I mean, we talk about evidence-based, and that's really what that means, that we have an opportunity to provide some aspect of spiritual care. And we can do it through intuition, or we could do it sort of the way we've always done it, or the way that we've seen our mentors do it. And that's all good. Like, I'm not saying we shouldn't draw on those resources, but I would also recommend that we take a look and see what the research says. And then when we're reviewing the research, to recognize that there are limitations. The science is being conducted by humans. And so there are limitations to all research. And you'll know in part that you're reading strong research because the manuscript or the article that you're reading will tell you the limitations. And so I think that's something that's important to realize as well, that when we decide what evidence-based material we're going to apply and translate to our practice, that we have enough of an understanding about kind of the scientific method to know that it informs what we do. It's not like we need to throw away our whole practice just to take what one study tells us, but that we are consistently keeping up on what is being done in our field in terms of research, and then being discerning about what and how and when we apply and to translate to the work we're doing.
I want to remind our listeners that we're recording this at the end of October 2023, and the last two episodes of NeshamaCast, which you can find in your feed, feature Rabbi Valerie Stessen and Rabbi Shira Stern, in which they both discuss the immediate aftermath of the horrific October 7th terror attacks in Israel. Allison, the trauma in Israel and around the Jewish world is massive and will be with us probably the rest of our lives. I'd be interested in hearing any preliminary reflections from you on this moment in time in general, and how researchers in Jewish spiritual care might address the after effects of this catastrophe. I mean, we know at this point there are at least 1,400 Israelis or people in Israel who were killed, and over 200 hostages. And so the ripple effects on the broader community is massive. So I'm curious what researchers will be looking for as affected people will be receiving spiritual care. What will be measured and how? You talked about qualitative and quantitative. How might this event affect the field of Jewish spiritual care. And even if you're not planning your own projects and your own research on this subject, I would find it interesting how you as a researcher would begin to map out the process of research in this situation.
Ooh, I feel humbled by the question, and it just feels so big. Part of the answer is I don't know, right? I think that there's just been a lot of shock. And as we know as chaplains, there's sort of life cycle to trauma and to loss. Everyone is just living day to day with what's happening and the way it touches people in various intense ways and degrees of intensity. I mean, I can't even begin to map that. This is just my tiny slice of perspective. I think first the stories, that's one of the things that qualitative research can capture. And I think already there's so many stories from everyone who's been impacted in various ways. And one of the other things I'm thinking a lot about is what I mentioned from the Superstorm Sandy research of this idea of normative loss and normative crisis in the context of a crisis that's being shared in such a traumatic way. And so, for example, one of the things that I saw was there's an organization called Life's Door in Israel, which Neshama has collaborated with over the years. And one of the things that I saw that they did over the past couple of weeks was they said, well, we're activating volunteers to make, and I hope I'm categorizing this right, but just summarizing an email I got from them, that they were activating their core of volunteers and helpers to check in with like homebound, ill, or elderly folks in regions affected. And I just thought that's happening right alongside all of this. And so if I were to bring my research lens to that, that's one thing I would say I'm curious about, just all of the different human needs and suffering that's happening. Because when a crisis happens, those other aspects of ourselves, maybe it pauses, but it doesn't go away, those kinds of needs. And that idea of curiosity and research, that's what I would say to anyone, that there are questions, natural curiosity that we have in a crisis that can actually lead us to that kind of inquiry. And of course, there's been a lot of work done over decades about trauma response, trauma care in that region and all over the world. And so I'm just kind of curious to see how that infrastructure will be activated, because I would say there is an infrastructure now for that kind of research, which is an advancement in that sense.
Yeah. As I noted at the top of the show, I was your student during the initial weeks of the COVID-19 pandemic. That was an event that profoundly affected chaplains and in many ways put us chaplains on the map as healthcare practitioners. At the same time, I've observed as the COVID-19 emergency phase has faded, healthcare systems in the United States are tightening their belts. How is research helping assure the permanent place of spiritual care in healthcare systems? Is it helping build up the value of chaplains in a healthcare system?
I sure hope so. One thing that I've noticed is that when we can sort of splice the chaplain data, the spiritual care data, along with other metrics that healthcare leaders need to pay attention to because they're needing to keep the lights on, right? The business side is important. But if we can, as spiritual caregivers, help interpret the work that we do through the data points that they really need to focus on, I think that's an area. And sometimes we can do that, through empirical research. Again, sometimes those are quality improvement projects that we do, sort of smaller, though really important projects at our individual institutions, splicing it with things like patient satisfaction, length of stay, use of aggressive treatments at end of life, like those kinds of things that we know have a dollar value attached to them. But I think for chaplains, we do need to continue to tell the story in a way that our healthcare leaders can understand. I think also the concerns about healthcare worker distress, the word burnout, I think is kind of overused, but we all know what it means. So just the role that chaplains can play with that. I always say we are, I think, the only discipline in healthcare that is trained and credentialed to take care of everyone in the healthcare system, not just patients and families. And certainly while there's great peer support that happens amongst other disciplines, we learn how to do it in CPE. And then in our continuing education, that's sort of lifted up as an important core competency. And so that is a huge concern for healthcare leaders right now from a place of genuine concern about the humans that work in these institutions, but it also has a financial impact. Turnover costs a lot of money for these institutions. And so what I'm hoping is more and more practice and research about how chaplains impact that.
Yeah, you raised an important point about how chaplains play a key role in supporting the interdisciplinary team and does what really no one else does and helps lift everyone up. Allison, as we arc towards a conclusion, the world is feeling very unsettled now for reasons we've already alluded to. What role can chaplains play in bringing a measure of healing to our communities?
What a big question. It kind of gives me chills even when you ask that, because there's just so many places to start. I go back to where I ultimately found myself in the beginning days of the COVID epidemic. I was taking care of myself and my family, my young kids who were home. And so certainly the importance of taking responsibility to care for my basic needs. And then from there to be providing spiritual care for those that were in my circles, those that I was touching, whether it was, people I was buying groceries from, or the CPE students I was working with, or, I was working with palliative care then. And I initially felt that was a very small group, and I felt very helpless and overwhelmed by the expansive need. And then when I started counting how many people that was and how then they were connected with others, it really just grows. You sort of you start to feel those concentric circles. And so to just start with our families and our communities, whatever that means, and knowing and trusting in our skills as chaplains. I may be naive. I still believe that our competencies as chaplains will help us to help others even during this time. And I could be proved wrong on that. There's a lot that's unique and very disturbing about, the moment that we're in. But I still do believe that what we've learned and what we practice as chaplains can help, bring about wholeness and healing even in the most distressing moments. So I hope that our colleagues will find that to be true.
Is there anything else that you wish to add before we conclude?
One of the challenges in research is that it's only as useful as the perspective of the people conducting the research and those that are kind of subjects of the research. And what I mean by that is there's certain perspectives that I have from my background that allowed me to sort of formulate research questions in a certain way. And I just think that, for so many of our listeners in different settings, different cultural backgrounds, however you understand culture, that to have just as a diverse group of people as possible involved in all aspects of research, I think will only improve what we're coming up with and how we're able to care for those in need.
Chaplain Allison Kestenbaum, thank you for coming on NeshamaCast. May you be blessed with strength and courage to continue your great work.
Thank you. You as well.
NeshamaCast is a production of Neshama, Association of Jewish Chaplains. Thank you to Chaplain Allison Kestenbaum for being our guest. For more information about Chaplain Allison, check out our show notes. Also in the show notes are links to articles and websites referenced by Chaplain Allison, as well as transcripts to all NeshamaCast programs. Special thanks for technical and logistical support to Rabbi Katya Philo, Allison Atterbury, NAJC Chief of Operations, Rabbi Ben Flax, NAJC Executive Director, and Rabbi Drew Kaplan and the NAJC Social Media Committee. Our theme music is a nigun for Ki'anu Amecha, written and performed by Rabbi Cantor Lisa Levine. Please help others find the show by rating and reviewing the show on Apple Podcasts. We welcome comments and suggestions for future programming at neshamacast@gmail.com. And be sure to follow NAJC on Facebook to learn more about Jewish spiritual care happening in our communities. May we all work together to heal our world.